Hey, good evening, guys. Welcome to day 19 of this vlog project. Again, I appreciate anyone who ends up tuning into this. Any feedback is encouraged and welcomed. I think today I'm just going to talk about a podcast that I listened to throughout the day. I may have started it yesterday, but listened to and finished it today. It was recommended by my brother, and it's episode 1671 of the Joe Rogan Podcast. The guest is Brett Weinstein and Dr. Pierre Kory. And the main topic of the conversation is a drug called Ivermectin. And these two individuals did a deep dive into the actual science, which is interesting to hear an actual well-informed, careful, methodical discussion of actual science and clinical observations, as well as real world in practice in the ICU observations from two guys who know their stuff from different perspectives of the industry. Brett Weinstein being more of an academic and more of a guy who has done a deep dive into the research and reviewing papers, and the Dr. Pierre Kory being a physician out on the front lines, actually treating patients and actually collaborating with other doctors and trading best practices, also digging deep into the available data and science and research that's out there, but also putting it into practice and actually treating sick patients. So without any of the, I guess, heightened emotions or just what would be the word, without any of the provocativeness or sensational nature of discussing these kind of coronavirus topics. It's just a super interesting conversation between a couple of men really interested in uncovering, truth, as opposed to being under the influence of organizational pressure. And so they talk about that a bit. So I think the main thing that worth sharing is that the drug that they talk about for a majority of the podcast is a drug called ivermectin, which I'm not a scientist guy. I'm not a physician. I'm not any of these things. So I have no place to weigh in on the subject. It was just a fascinating conversation that I would recommend everyone listen to and to draw your own conclusions. But from the sound of it, it sounded like, which to me is not that mind-blowing of a concept, but it sounded like with the entire roller coaster that we as the human race went through in the last year, that it really was that simple, that there were certain substances out there, and this one in particular, that's safe, and it was proven and continues to be proven to effectively treat the illness that drove everyone locked down into their homes, etc., etc. And I mean, it's from randomized controlled trials to actually being put into practice in different regions and seeing, tangible effects. They used Mexico as an example. They put this into play and drove the virus to basically extinction in their area. So while I don't think, I never thought throughout the last year that this was a subject worth changing our way of life over, which is actually funny to come full circle. The first material I listened to on this subject was by, at the time, another guy who seemed like a very credible source, who was also on Rogan's podcast, and he was a big name within, it was like the CDC or it was some different organization, but it was a government organization. And I remember what the guy said was, hey, there's like with something like this that's coming, the wave that's coming, there's not much you can do about it. And he said, unless, we want to completely change our way of life, and even then we don't know if we'll get any better outcomes. So I remember that stuck with me throughout, and was a mentality that I had that, hey, nature's going to take its course, and kind of regardless of what silly actions we may take in the realm of, wearing pink hats on Wednesdays, or wearing our shirt inside out, or wearing sunglasses, whatever we collectively decide to do to make ourselves feel better, hey, nature's going to take its course. That being said, it sounds like there's effective treatments and preventative benefits to the drug that these gentlemen were talking about. Again, not a scientist, not a physician, but I think when you hear these guys talk about it, it's really hard to dispute the case that they make for this generic drug that's safe, that's used in a lot of other uses. So, and the point that they kind of came around to, or danced around, and a fair amount of times, was the idea of, well, why was this never promoted? And it seems pretty self-evident that, hey, you have, at least in our country, these large pharmaceutical companies that are propped up by the high barrier for entry into their industry, that is propped up by the government agencies that quote unquote regulate them. And a term that they threw around that was a new way to articulate, and I'm definitely going to steal this moving forward, is the term regulatory capture, or just capture in general, right? They were talking about all these different organizations, whether it's the WHO or the CDC and so on down the list. They said at a certain point, if the organization has been compromised, if they're no longer providing information or recommendations based on good faith, or if it just seems like there's influence being exerted over them, they referred to them as being captured. And I thought it was a great turn of phrase that, I guess, maybe it's more common than I'm aware, but I'll definitely be using it moving forward. But I think the point to take away, and this is where I think it would be great to get those guys in a room with a guy like Peter Schiff, because he would be able to just take them one step further and show to them, because you could tell they knew that this was the problem, that, hey, you have like the FDA, but if the FDA is being bought by a larger company, or if it's just been infiltrated by the industry that it's supposed to be regulating, which always happens, by the way, which is kind of the point that Milton Friedman makes in his book Free to Choose. Any regulatory agency that's, when it's first started, is, what is I can't remember the case that he makes for why it's even started in the first place. He says it's never the it's never the consumers that are calling for, hey, these industries need to be regulated. It's a special interest movement to get an industry regulated. But once that happens, and any people who were maybe had good intentions from the start, those people move on to their next mission. And now, with the amount of money at stake, with the amount of taxpayer dollars at stake, it's well in these companies' benefit to gain influence and exert influence, or wholly take over the agency that's supposed to regulate them. And he has multiple examples of this. The ICC, I believe it is, the Interstate Commerce Committee, something or another, that is supposed to regulate railroads, trucking, etc., that once the industry takes it over, they use it as a tool, as a legal tool, as a government, as a branch of the government, to limit competition, to prop up their position within a particular industry, right? So the solution to this is close down those agencies. Get rid of them. The free market will regulate itself. Consumers are going to go to where they want to go and will ultimately be more efficient at regulating, and competition will be more efficient at regulating good practices than a agency with the power of the government, with the power of coercion, that can be easily taken over or influenced by the industry that it's supposed to regulate. So I think that was the one step, if being a fly on the wall, listening to the conversation, I may have added is, hey, yes, the CDC has been captured in the terminology that they were using, but the solution is get rid of the CDC. There will be plenty of incentive, just like this gentleman, Pierre Kory. He's part of a nonprofit, private philanthropy. There will be plenty of incentives in a completely free market for people to still perform the function that we would want the CDC to perform, but it'll be in a voluntary manner. And the moment it makes a mistake, people will lose faith in it, and other agencies will be able to compete with it and try and put out better information and try and inform people better and recommend better practices, right? So like over this last year, if we had said, wow, the CDC has been wrong at every turn, they're changing up their story, they're giving out bad information, or things just don't logically make sense, or the head of the CDC one day is saying, hey, don't wear a mask, and then a couple months later he's saying quadruple mask, and yet he's out in public with his mask on. No, that's not important. But the moment people lost faith in a particular agency, if it wasn't being propped up by taxpayer dollars, it would lose shareholders, it would lose funding, et cetera, et cetera. Or people would just stop paying attention to it, and their attention would drive to an agency that they did have trust in, that did have integrity. So that was, I think, the main point that I took away. So again, if anyone stumbles across this video, I highly recommend that episode, and I encourage you to contemplate this idea of regulatory capture and what the actual solution is, right? And it seems like these are discussions I get into a fair amount, or whether it's online little sparring sessions back and forth of the idea that there's these kind of monopoly type corporations that are preying on the consumer. And it's like, yeah, sure. But the only monopolies that ever last or that exist for a long time are being propped up by government agencies. And that may just be as simple as creating barriers for entry for other competition to come in and compete with them. So if the cost, and people just kind of accept the notion, the cost of a drug to take to market is X billion of dollars, et cetera, et cetera. Well, it doesn't have to be the case, right? The reason it's so expensive and the reason the prices have gone through the roof is because of the red tape and the regulatory burden that it takes to bring those to market. So if you take all of that away, you would lower the barrier for entry, you'd allow more competition, you'd allow consumers to decide for themselves, and I think we'd all be better off for it. So anyhow, that's all I got tonight. Again, appreciate anyone tuning in, and look forward to seeing you guys tomorrow. Cheers.